Okay, well, we're going to go ahead and get started. Looks like it's just a couple minutes after after 8 o'clock, and as people trickle in. So I'm Heidi Roschinger. I'm a nurse practitioner at Virginia Commonwealth University Health and Advanced Heart Failure Clinic here in Richmond, Virginia. And I have the pleasure of serving as the moderator tonight. And so I want to welcome you to this mentoring webinar where we're going to discuss careers in academics, research, and other clinical areas. All of us tonight know that nurses are a critical component of a multidisciplinary team that cares for our complex and vulnerable heart failure patients. And so, as a nurse, finding your seat at the table is often difficult, but nurses are crucial to the successful care of our heart failure patients and the growth of our organization. Tonight, this webinar is an opportunity to discover some of the opportunities available to nurses. And so we have a panel of heart failure nurses and advanced practice providers who will discuss their experience working in heart failure across various settings. They will also discuss how they advance their career as a nurse in the heart failure community. I know I am excited to learn of the secrets of their success and how they grew in their career and how I can grow as a professional nurse. So I just ask everyone to mute themselves. I'll start by introducing our panelists, and then we have some questions. Please feel free to put any questions that you have into the chat for the panelists, and I will get to those questions as well. So I'll start by introducing Quin Denfeld. Quin is an associate professor at OHSU School of Nursing with a secondary appointment in the School of Medicine, Division of Cardiovascular Medicine. Dr. Denfeld's program of research focuses on the biobehavioral mechanisms of symptoms and frailty among adults with heart failure, with a particular focus on women and older adults. She is currently funded by the NIH, NINR to lead a R01 study that focuses on the biological and physiological mechanisms of symptom clusters in heart failure. She has also recently received funding from the NIH, NINR to lead an R21 study that focuses on how physical frailty is related to self-care behaviors in heart failure. She is the next generation research co-director for the K-12 Building Interdisciplinary Research Careers in Women's Health program at OHSU and teaches in the PhD program at the School of Nursing. She is involved in numerous professional organizations, including leading several scientific statements on symptoms, falls, and frailty, and she serves as an associate editor for the European Journal of Cardiovascular Nursing and an editorial board member for the Journal of Cardiac Failure and Journal of Cardiovascular Nursing. Dr. Denfeld is a fellow of the American Academy of Nursing, the American Heart Association, and the Heart Failure Society of America. Tonight, we also have Meg Fraser. She is a nurse practitioner at the University of Minnesota. Dr. Fraser has been an active member of HFSA since 2015. She is involved with AHFN and AHA and has served as a writing group member for scientific statements on heart transplant topics and care of the hospitalized heart failure patient. She specializes in providing care for patients with advanced heart failure and after heart transplant, as well as those with genetic cardiomyopathies and cardiomyopathy-related muscular dystrophies. While her primary focus is clinical, specifically acute care, Dr. Fraser has participated in several research activities, including membership of the editorial board of the Journal of Cardiac Failure. She enjoys sharing her passion of heart failure care by precepting several MP and PA students each year. And then we have Dr. Joy Coles of Lexington, Kentucky. She is a doctor of nursing practice, nationally board certified as an adult gerontology acute care nurse practitioner. She currently works as an advanced practice provider on the Advanced Heart Failure Heart Transplant Mechanical Circulatory Support Team at the University of Kentucky Hospital. She received her first Bachelor of Science in Biological Pre-Medical Sciences from Wright State University in 2002 and worked in clinical research for several laboratories while in training. Then contracted with multiple biopharma companies post-degree as a clinical research site manager while acquiring her MBA from the University of Phoenix in 2011. Joy felt compelled to answer her calling of becoming a nurse practitioner, so she received her BSN from the University of Kentucky College of Nursing as a second-degree nurse and became a lifelong UK Chiltern Honours Fellow. She worked over a half a decade as a CV-ICU-RN before becoming a doctor-prepared nurse practitioner and has practiced as an NP over the past 5 years. She is a member of several Nursing and Heart Associations, has several awards. Um, and she is currently, I'm sorry, Joy. I'm getting lost. She is given back through her multiple faculty teaching appointments at both the University of Kentucky and Kentucky State University, where she has worked as an assistant professor, clinical instructor, and preceptor, with her most recent promotion at KSU as the DMP track coordinator. And then her interests include community service and through her active memberships in Alpha Kappa Alpha Sorority, Incorporated Health Policy, and Patient Advocacy. And so we have a great group of nurse practitioners and advanced practice providers and nurses in this heart failure community to share tonight. So we'll go ahead and get into some questions. Again, remember, if you have any questions, please put them in the chat and we will get to those questions at the end. Okay. Quin, what decision was the most successful in your career?
Thank you. Thank you, Heidi. And thank you to the HFSA for the invitation to be part of this panel. I'm very honored to be virtually sitting alongside you all. So the best decision, I'll answer this in two ways. So first, just two decisions that I made in my career that I'm very happy I did was one, first, becoming a nurse. I'm very glad I made that decision. As it has aligned with who I am as a person. And then second of all, just making the decision to pursue a PhD, which I think further honed my career into and better aligned it with what I wanted to do for my own career. I'm going to ask everyone to mute if that's okay. Thank you. So those were probably the two best decisions. That's what immediately came to mind when posed this question. But then the other way I would also answer this is to say that what has been kind of a constant decision in which it has allowed me to be successful in some realms is to be open to any possibilities, to be open to opportunities that have arisen and jumped at those opportunities. Obviously, you can't say yes to everything, but there have been certain ones that have been that have really opened doors. And so joining HFSA is one example where it has opened up so many other doors beyond just simply becoming a member. So that is how I would answer that question.
Thank you. Meg, what strategies have been effective for finding success in the heart failure community?
Hi, I echo what Quin was saying. Thank you for having me. I think, I read this question, I think sort of two ways to look at the question. One, in the heart failure community of professionals, I think exactly what Quin said, my involvement with HFSA has opened up so many doors, and almost everything that I do that's non-clinical has been either directly with HFSA as an organization or through networking, meeting people through HFSA that has led me to other opportunities and organizations. And I think, if taking this question a different way and not so much the professional heart failure community, but just in like heart failure care, sort of this similar thing in, outreach and networking locally. So I'm in Minneapolis. And just success for like our heart failure patients and the heart failure community locally is just being able to network outside of the urban area that we are. And we do a lot of outreach care of heart failure patients. And that's how our program has really succeeded.
Thank you. Joy, what have been your biggest challenges in your leadership role, and how did you overcome them?
Some of the challenges that I've encountered, first and foremost, I have to echo the sentiment of both Meg and Quin, my colleagues in this heart failure community, and yourself, Heidi, and being grateful and gracious to be here this evening and joining everyone. So thank you for having me as well. Some of the challenges, especially being in nursing academia, have been navigating this new journey. When I initially, because I came in as a second degree nurse, I decided that I wanted to pursue my passion. It was always there. And I'm so glad. I always tell my students alike, it's one of the best decisions that I ever made. And some of the challenges is that not knowing, right? You can't know what you don't know. And so some of the challenges that I've had in regards to navigating my career, both professionally and academia, and as a advanced practice nurse, has been navigating a road uncharted. And so mentorship has been pinnacle. It has been very important to both surround myself with individuals who've already foraged and gone through a way that I have not journeyed. Much to Meg's point as well, the Heart Failure Society of America has been a sounding board of sorts because of the wealth of knowledge from all the very individuals who are part of this wonderful organization. Having those mentors, being able to find other people who are in the profession who have like goals to myself has been one of the ways I've overcome those challenges. And it can vary. There's various things that you can encounter, whether it's understanding tenure that came with its own um, language and um, uh, no map. I didn't have a map at all. And so it was that mentorship that kind of got me through there and that yearning for learning. Always, one thing I love about being a nurse and collaborating with nurses is that we all have this zeal and this passion to continue to rise. And so, whatever situation or circumstance we find ourselves in, um, we often we often overcome them because we have that zeal and that passion toward pursuing our goals. And so, I would say that that tenacious zeal, as well as mentorship, finding individuals who've already chartered the course, has been extremely helpful in being able to overcome some of the challenges that I've experienced both in academic nursing as well as in practice.
Thank you. Um, Quinn, back to you. What would you say has been your biggest mistake in your career, and what did you learn from it?
Mhm. So I love this question. It's also a very hard one to reflect on. So have I made mistakes? 100%. I've made mistakes at the bedside. I've made mistakes in data analysis. I've misspoken. I've said the wrong thing. I have just simply messed up. And so I think when I make those mistakes, I immediately admit them, because I think just getting it out there and not swallowing it is one of the most important things to just learn from it. So I think it allows you to overcome that guilt. And we're human, so we have to admit that we are going to make mistakes. So I was really, really digging the depths of my memory to come up with the biggest mistake, and I couldn't quite come up with the biggest one because maybe I suppressed that memory. But I would say overall, my biggest mistake is not asking for help when I probably needed it. And that goes for being a new nurse in the cardiac and surgical ICU, because there it's a sink or swim kind of environment and they expect you to know things. And so I expected myself to know things when I wasn't really prepared for it. So, from that moment until even present day, when I realize, have I bitten off more than I can chew and committed to too many things? Yes, the answer is probably yes. So asking for help and saying, this might not be an opportunity for me, but it could be an awesome opportunity for somebody else. So maybe allowing somebody else to mentor that student rather than putting it always on myself. So I think that would probably be my biggest mistake, and one that I still keep making, to be honest. So just ask for help, whether it's something small or something big. So that's how I would answer that. I'm sure I will come up with a bigger mistake later on, which I will share personally, maybe with people.
No, I think that's an excellent answer. We can all learn from that. I mean, that's a skill we all need. Meg, who has been the most influential mentor in your career?
So that's an easy answer for me. Before I worked at the University of Minnesota, I worked at the University of Colorado in heart failure and heart transplant. That's where I got into the kind of advanced heart failure role. And I worked with Colleen McElveen and at Colorado who had been, in that role for a couple of years, was really starting to lean into the research side of things. And so really kind of took me under her wing, taught me a lot that I clinically and just professionally, and really pushed me to get involved with HFSA. She's from Wisconsin. I'm from Minnesota. We bonded over that. And so definitely Colleen, I owe a lot of the opportunities I've had to her mentorship and advocacy. And then I think also it's really important to have multiple mentors and mentors from different disciplines. And so I've also been really fortunate to work with a handful of heart failure and transplant cardiologists over the last few years, both at Colorado and at Minnesota, who've just been really supportive of me and advocated for, some non-clinical time for me to do some passion projects and things. And so I've had kind of multiple mentors at different disciplines that have really been instrumental. And so I encourage people to seek out sort of, again, multiple mentors and across different sides of the heart failure coin.
Thank you. Joy, what do you do to continually learn and grow in your leadership skills?
I am a conference girl. All things conference. I am big into attending HFSA every year, even serving on several committees, and always continuing to be open to new knowledge, new information, and glean and grow and bloom wherever it is that you're planted. So I would definitely say attending conferences like the HFSA meeting, those are areas where you can continue to grow. There are sessions on various topics across advanced heart failure, and in whichever respective area that your focus is, or wherever you want to do career advancement. And so I find myself looking for opportunities. And there's several, right, all over the country, and some in some really nice warm places where you can go and learn and connect with individuals like Meg, like Quin, who are leaders in their respective areas, and other people like folks who have mentored me or who I've admired through the years, like Deborah Moser here at UK, and others. If I get to naming folks, I'm going to miss somebody, because there's just too many to count. And that is where I've gleaned and learned and got that information. I cannot say enough, and I don't want to be redundant, but I just cannot say enough about mentorship and how important and valuable that can be. That is probably been the most value added I've had in regards to learning and keeping up on latest, greatest, newest knowledge and everything else. Because my mentors, who are leaders in their own right, in the area of advanced heart failure, people like Dr. Emma Burks and others, they're the ones who are pointing out various new publications, or they're working on publications themselves, establishing best practices, and always encouraging us to practice according to to get with the guidelines, right? And so surrounding yourselves with those individuals again, and then attending those conferences or meetings where there's opportunities to continue to learn.
Thank you. Quinn, what would you share what do you wish you knew earlier in your career that you've learned now?
Everything. I wish I knew everything. No, I think there's lots of little things that I would say I would have liked to have learned earlier. So I'm just going to take a step to the side and tell you a little bit about kind of my day to day, where I run a research team, a research lab. We don't have a wet lab area, but I have a couple of people who work with me because it takes a village to run research studies. And so I have become the de facto leader as the principal investigator. And so I think being in that role has been quite scary because I'm in charge of a budget. I'm in charge of hiring and firing. I mean, I haven't had to do that knock on wood, but that's something I was not taught how to do. So I guess there's a lot of skills around managing teams, managing budgets, running an organization or running some kind of whatever that might be. And that could even be as an advanced practice provider running a clinic. So there's just a different level that I was not prepared for. And kind of going off of Joy's point about kind of the uncharted territory, I feel like with each level, there's been even more uncharted territory. So I've been trying to pick things up. So there's definitely some things I would tell myself as a younger nurse or investigator, here's what you should focus on. So there's definitely that. And then I think the other thing is just to tell myself, it doesn't all have to be done at the same time. So like there's a reason, it doesn't all have to be done like XYZ or ABC. It's okay to let it take a little while. It's okay to let things kind of simmer or just kind of be as they are. So there's a lot of things, and I struggled with this to thinking about the answer of this question, because there's lots of little things. But so I guess, on the one hand, there's certainly lots of little things that I wish I would have known, but at the same time, that's why we have a team, and that's why we have mentorship, and that's why we have people to help guide us. So for every turn I make into the next level, I turn to my village of mentors. Like Meg said, it's not just one, but it's multiple.
Thank you. Meg, do you have any specific books or things that you recommend on leadership to younger nurses or people coming into leadership roles?
So I was hoping to not get this question. I don't read for fun. I'll be honest. I don't read for fun. I wish I did. I think I've tried. And if I do read for fun, it's true crime or murder mysteries, and it's not leadership books. But it's still my answer, because anything I read, I try to make it not about work or not about clinical. I just think it's really important to, I have 3 kids under 6, and I work full time. And I think it's really important to shut your brain off and do some non-clinical, I wish I could say I read all these journals and, leadership books and took seminars and things, but I just frankly don't. And so I like to use the free time that I have to do non-work related things. It keeps me sane. So that's my answer. I don't know if anyone else has a better answer prepared, but that's what I got.
I think that's great. I mean, it is important that we have that time to regroup and have self-care and take care of ourselves. So we appreciate that. Joy, what is the best piece of advice you've ever received?
And actually, I will piggyback off of Meg's question a little bit in regards to some of the things, some of the books and that have some very valuable advice. There's a book by Brene Brown. It's called Dare to Lead. And then there's another book, the author escapes me, but it's called Atomic Habits. And so some of the best advice I've really gleaned from those sources, as well as other mentors and also my experiences, has been to small successes are successes, and utilize the momentum that you get from the potential energy that you're building up, right? From those small successes to give you that push to go into something that you've been daring to do, you've been desiring to do. Oftentimes as leaders, sometimes there's this reservation or this gnawing, this sense of, I don't want to fail, especially to Quin's point, when you are responsible for the success of not only yourself, but the upward climb or or whatever that success may look like for others, for other nurses who are either under your leadership, who work alongside you. And so it's not just about you. And so the book Atomic Habits and both Dare to Lead challenge your paradigm to think about those small things that you can do that ripple into bigger things, as well as that daring, right? That goal to go after it, do it. If you find yourself really being passionate about becoming, um, a nurse leader in whatever capacity that may be, whether that's in academia, one of my, I love being a DNP track coordinator here at Kentucky State University. It has been a joy. It comes with its own various challenges. Um, I kind of wish somebody would pull me to the side and said, "Oh boy, just wait till you go through an accreditation visit. It's a good time." And so those things like that, those skills, but being daring and understanding, yes, it will be challenging. Yes, there are things that you don't know, and there is uncharted waters. But let those little successes, the little bits of knowledge that you gather along the way help you, as well as continue to learn and be open, to gather information from others who've already chartered the way. And so those two have been very impactful on me, as well as continuing to celebrate small wins. It's important, really, truly, and keep going. Do it. Dare to lead. Dare to keep going for the gusto.
Thank you. Quinn, what qualities do you think nursing leaders need?
Yeah, so I mean, I think this goes to all leaders, but communication, 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 and being open, listening to others, and communicating in return. So active listening and then communicating with your team or whoever that might be. And it doesn't necessarily need to be talking, talking, talking all the time, but just showing up, how you present yourself, how you interact with other people. So I feel like that to me is the one go-to quality that I would say. Um, and the other thing I would say, and actually this is a sign that's outside my home office door. It's actually a sign that I had up there when I was homeschooling or teaching my children during the pandemic, but it says work hard and be nice. So every time I walk into my office, I think first of all how poorly I taught my children during second grade, during virtual learning. But then also, that's what my go-to is, work hard, but also be nice. Everybody's going their own course, whatever that might be. And so success to them looks different than success to you, as a leader. So that's where active listening comes in, getting to know who you're working with, who you're leading. And yeah, I could probably wax on a lot more, but I'll stop. I'll stop there.
Thank you for sharing. What about May? What would you say is your biggest regret in your career?
So I thought really hard about this question too. And it's cliche, but I don't really have a regret per se. I think there's a few things that, had I been more thoughtful or done or known about, I would have maybe attempted to do differently. So I am, as you mentioned, my bio, I'm primarily in an inpatient acute setting. I do some clinic, and I enjoy some of the balance, but I really do like the acute care setting. And when I chose my NP program, there was actually no acute care programs in the state of Minnesota. So I went with I wanted to go to a university of Minnesota was kind of the one school I applied to, and I did the program that it was, and it was an ANP program. And in my role now with experience, I am comfortable in my role. And but I think had I been a little bit more conscious or had researched maybe programs or facilities, I maybe would have gone just a different NP program route and maybe more an acute care NP program route, because that's really kind of my passion and has been. And I think, fast forward 10 years later, I don't think that much would have changed. So I wouldn't call it a regret, but I think that if there's anybody, listening around the call that's considering like an APRN program, maybe just really doing some good research as far as the differences between the different programs and, the difference between a family NP and they've phased out the adult NP, but adult gero primary care versus inpatient. That also being said, at the time, I probably thought I really did want to do a lot of clinic work, and it's really not until you kind of get your feet wet that you really maybe find your passion or what you kind of feel like you're best at or best suited for. So I don't know if anything would have changed, but I think that's the one thing I came up with was like really maybe would have been a little more intentional with the program I was seeking out.
Thank you. Joy, what do you do to encourage creativity in your organization?
Allow people to really truly have a voice. And to Quin's point, listen. There's something to really truly be said about active listening. People are more willing to share their thoughts, their ideas when they know they'll be welcomed. So it is important in order to foster creativity, creativity has to be essentially the mantra of the organization or a part of that culture. So, in order for folks to feel that they can share and that their ideas won't be shut down, there's got to be an environment where that can be received. And so, I would say, in order to really truly encourage or foster creativity, that environment, that culture has to be conducive to allowing people to feel like they can be creative. Come with your ideas, share what it is that you're feeling may be beneficial to the program. I sit as a academic leader in nursing. I sit on several committees and I chair some of those committees. And one of the first things that I do is open up the floor. I know oftentimes in meetings, we have to stick to agenda and we have all of these various things that we must cover. But I like to start with allowing freedom of thought, freedom of expression, and allowing faculty to be able to express if there's anything that is pressing. They may have just attended, NONPF, or which is the National Organization of Nurse Practitioner Faculties, or some other conference or meeting, or collaborated with a faculty member or a nurse practitioner like yourselves at VCU or Colorado or what have you, and have some thoughts, have some ideas. I know even recently, the faculty have been very excited about AI. And what is that going to look like for nursing academia in the future? We're Whether you embrace AI, you don't like AI, or you just want to run because you don't know anything about AI. It is here. That element of artificial intelligence, we're seeing students be very savvy. Meg mentioned, in earlier years, gosh, most of us here, we've been practicing for over a decade or better. And so you researched, and the information that was out there was somewhat limited. But as things have evolved, um, truly, I know the internet was coined as the information highway, but it is truly an information highway at this point. And so being able to siphon some of that and really understand that folks, give people the ability, give them the platform in order to share the ideas, because we're all better together. And our most creative um wins come from when we collaborate with one another, and so it's important that the environment is conducive for that.
Thank you, Quinn. Along those same lines, how do you promote a positive work environment where you're at?
Well, I'm just gonna say ditto to everything that Joy said because I think she's spot on. So yeah, I think I won't say much, but I would echo her and just add that well, first of all, you can ask my team if I promote a positive work environment, but I at least try to, and I have tried to, whether I'm working in the cardiac and surgical ICU, whether I'm in a PhD program, whether I was in my lab working as a postdoc, and then now moving back to faculty. But I think just people want a sense of belonging. They want to know that they belong wherever they are, and whenever that might happen to be. And however that looks to create that sense of belonging is whatever that needs to be. So maybe that person needs, a little more attention. Or somebody might need a little bit more attention. They might need to they want to talk about whatever's going on, which is, a big chunk of our lives, is a place where we're welcome. And then the other thing I will just end with is a saying that I believe I heard at an HFSA meeting a while ago, but they said the highs are high and the lows are low, but we're in it together. And so I feel like that really resonated with me, because we all kind of ride this crazy roller coaster of life, personally and professionally. But to know that you have somebody who has your back, who's at your side, who can guide you along the way, really helps to kind of bolster you. So that's where I have landed with my philosophy around positive work environment.
That's a great quote. Thank you. Meg, what would you say drives you currently, or what is your motivation as a nurse leader?
So the short answer is my kids, and not for the cheesy they're my motivation like answer. I think for me, I'm a better mom because I work and I have this position and job that I love and field that I love, and I really enjoy my job. I really do. But I feel like just, raising kids while doing work, I know I'm a better mom because when I'm with them, I can kind of turn it off, but I'm the type of person personally, I think a lot of us nurses are, where we need to be using different parts of our brain, that I could not just do one thing. And so I continue to work and I like to work. And it makes me a better mom at home. And I think it makes me just kind of more well-rounded. And then just as a nurse leader specifically, I just, again, like really enjoy what I do. I really like this niche of heart failure and heart transplant. I love being in sort of a subspecialty and kind of being able to, as a nurse, really hone in on like a really specific patient population. I think it's very rewarding. I think there's a lot of opportunity for nurses in this field as well. It's kind of there's a lot of physicians at HFSA, and there's really not that many nurse leaders within our organization. And so it's just motivating to, again, like be part of sort of this not that large, but really connected community, all with like kind of a shared goal. And it's been fun and rewarding, and I really just enjoy it.
Thank you. Joy, what behaviors or choices should future nurse leaders avoid?
Some of the behaviors to avoid is rushing to judgment. I would definitely say it could be detrimental to yourself. I know professionally, sometimes just pause first. And I'll give you an example and just be transparent and share. The Our university was working on making some enhancements, and it appeared that they were essentially going around our usual processes. But without the investigation, that would have been the assumption. However, the goal was to make sure that we ourselves, as faculty and the leadership in the School of Nursing, had additional support. And so without inquiry, it would have just been assumed that this was so that's why I would encourage one to pause and really look and investigate and see, let me try to understand. It's kind of like what we learned when we all were first new nurses, right? Remember that in nursing school, tell me more. We have to do the same thing professionally as nurse leaders. Tell me more. Really truly understand before you act, understand before you make a decision, understand before you rush to judgment. And so, if there was any behavior that I would say to caution any nurse leader, was to not be hasty. And I think the second part of your question, if I'm not mistaken, Heidi, was what behavior and what was the other part?
Choices.
Oh, choices. Yes. And it kind of parallels to that, right? Choices to speak out of turn. Sometimes silence is golden. Just to kind of sit back and really see and understand what's going on first, before you, one, rush to judgment, but and also two, to speak out of turn without really truly understanding. And these seem like, you know, things we already know, right? But professionally, in the moment when you're passionate about, in my case, you're passionate about the curriculum, you're like, no, nurse practitioners, they must have these skills, and we have to make certain that all of this is included in the curriculum, and you're passionate about those things, to really truly take a pause for a moment, and ensure that every voice is heard, and truly that everybody's on the same page, and that we have understanding with one another. Same holds true for practice too, right? We do that with our patients. I still practice as an NP in heart failure, heart transplant, and MCS, taking care of LVAD patients. And my biggest goal when I walk in that room is always just to step back and listen, not to make any assumptions about what I've already, gathered from their chart, what was even told to me, oh, such and such, or this and that. But to really truly step back and, be able to listen and help my patients feel heard, much like my faculty, and much like my students. It all, it works in whichever environment in which you're leading as a nurse, and it will serve you well.
Thank you. Quinn, do you have any recommendations on like what educational opportunities or certifications nurses should be looking at for as wanting to be a nurse leader?
Yeah, this is a great question. I think I'll start by saying honestly, there's so much out there that it's a bit overwhelming. And I remember starting out as a new nurse being like, "Wow, what do I do next?" Because there's so much that's out there. Do I go back to school and be a nurse anesthetist, or become a nurse practitioner, or do I do this route? I mean, and those are big questions. But there's also little questions. Do I pursue this certification or that certification? So I guess my answer would be first, actually, I'm going to take a beat from Joy and pause and just go, take a breath. What do I want to do? Where is my passion? Where is my North Star? What kind of leader do I want to be? And honestly, I don't think you're going to find that in a book. So Meg, I think you're spot on. Like there's books out there on leadership, and the one that comes to mind is Leadership Legacy, I think is what it is. But honestly, my biggest epiphanies as a leader have come, or what I want to do with my career have just come while I'm running, or I'm washing the dishes, or I'm just doing something else. I'm like, that's what I want to do next. So my first advice is to think about what you want to do. Then my second step would be talk to a person who's done that. And that goes to Meg's point about figure out, is it this or is it that? And that's what I would do, what I did. And then third, try it out. And if it fails, it fails. Like, it's okay. You can always pivot and do something different. So I'm sure I could offer a million different suggestions, but you can look at HFSA, you can look at the other professional organizations, you can look within your own organization, see what makes sense for you. And yeah, so those are my 3 steps for educational and certification options.
Thank you. Meg, how do you encourage nurses' involvement in the heart failure community?
So I think, as we've all said, and I swear none of us are being paid to say this, but HFSA has been just absolutely the most influential part of my whole sort of career. It's feels like a family. It's a really tight network. Every time I go to the annual meeting in September, I come away feeling like refreshed and like excited and reminded why I really just love what I do. So I think, and Joy said this too, but like attending meetings is just so has been so just helpful and inspirational in my career. I've met Joy and Quin before at HFSA meetings, and we're like 3, advanced practice nurses across the country who all just met at the meeting, the annual meeting. And so I can't say enough about kind of what that meeting has meant to me personally. And then even on a local level, I think, one thing that we did in Colorado that we've tried to implement in the in the Minneapolis area was just sort of like journal clubs have been really a cool way to kind of just on a more local level interact with other nurses and advanced practice providers within your kind of smaller community just to share ideas and you can find out kind of what other programs are doing slightly differently and things. And so I think some kind of nurse and APP driven journal clubs have been another really kind of neat way to be involved.
Thank you. Uh, Joy, what type of professional and personal skills do you find that nurses need to be successful?
Oh wow, that's a loaded question. I'm going to start with what nurses already come with. We already come innately with this longing, this desire to be of service, right? You will be hard pressed to not have a nurse tell you that one of the reasons why either he or she or they went into nursing and that they really truly had a desire to help, to be of service to others. And so we already have, if I may, the ingredients, the main ingredient for being successful. And some of the other skills and talents that nurses hold that already have been mentioned here by Meg and Quinn have been um, listening. Nurses do fundamentally communicate, right? Because we listen, because we ask questions, because we're inquisitive, we're curious. It's one of the reasons why we went into nursing, right? We want to know more, we want to learn more. And especially as a nurse leader and an advanced practice nurse, you advance your training because you do want to know more, right? You want to do more. And so some of those skills, and what we call soft skills would be being an effective communicator and making certain that you're understanding an individual or group and that they're understanding you and being able to clearly communicate that. Some of those what we call harder skills that nurses may need to lead is some of the things that we've got that you get from mentorship, right? You don't know what you don't know. um, Again, this is an uncharted path, and it's okay. I think someone had mentioned to not be so hard on yourself. You can't know everything. The information highway, all of the various YouTube channels and nurse influencers and everybody else that's out there, there is just so much information to sift and sort through. And so, really truly find someone who can model for you what it is that you desire to do and glean from them and other nurse leaders who have gone before us and really truly look at some of the skills that they inhabited. They were tenacious. Nurses lead with gentleness and kindness. I love that what Quinn said. That's that sign sitting on our door. Remember to be kind. Remember to be thoughtful. Remember to think of others. Again, we already innately have those skills inside of us, but sharpening those and allowing the experiences that you go through, even whether hard or bad or tough, or mistakes that you make, to sharpen you even further. Um, there's nothing wrong with making a mistake because ultimately it should help you not to make the same mistake again, and you can share that information knowledge with others. And so all of those those skill sets in combination really is the ingredients for a wonderful nurse leader who is going to lead with gentleness, um, astuteness, and that's competent, right? We still have to hone our craft, we still have to refine our knowledge and what we know by mentorship and attending meetings and getting certified. All of those things that we do all will help in order to make you an effective leader.
Thank you. Well, we are almost out of time. So before we wrap up, I just wanted to give each panelist one more opportunity. If there was something pressing that you had any recommendations for nurses listening tonight, if you have a brief answer of of something that you would a take home message for each nurse listening tonight. So I'll start with Quin. Any recommendations you have for nurses tonight?
Well, first, I just want to thank everyone who showed up. I think showing up is one of the biggest steps you can do in becoming a leader and taking that next step in your career, learning about what's out there. So thank you for showing up, and thank you to those who end up listening to this later on. I really appreciate it. And then the other thing is do something, step outside your comfort zone and have a coffee date with somebody that you are like, maybe I want to do what they're doing, or maybe we can chat about this. So it sounds scary, but it actually is, it ends up being less scary than the anticipated nervousness. So just try it. You never know what door it might open up. And then come to HFSA, because we do need more nurses there, and I will be there in Atlanta. So please come. I would love to see people there, nurses especially.
Thank you. Meg, any final words tonight?
Yeah, I would say, and I said this in a talk I gave actually at the meeting last year, but if I could come up with kind of one piece of advice for either nurses starting out, either in the nursing role from the beginning or transitioning from, bedside nurse to advanced practice, is say yes to everything and then learn to say no. So like when I first started out, especially in advanced practice provider, and really was, getting my feet wet and kind of then jumping into the whole heart failure community, I said yes to just everything, even if it didn't sound all that interesting to me at the time. But I learned something from pretty much everything I said yes to. And then when I sort of felt saturated, then the art of saying no is just as important, if not more important. Prevents burnout, and really you cannot be good at it all. You cannot say to it all. So really then being able to, with some experience and some time, kind of focus on what you really want to do. And that's what you're going to be good at. And so just learning to say no and feeling comfortable saying no.
Thank you. Joy, any last comments for tonight?
Yes, go to HFSA and not just come to the meeting. Grab a mentor. Have a cup of coffee with Meg, with Quin, myself, with Heidi, with other nurses, nurse practitioners, nurse leaders who are in the field. One thing I love about nursing, and I was a second degree nurse, right? I had a whole career in biopharma. And one of the things that I've always enjoyed about nurses and being a nurse is our willingness to go out on a limb for each other. It's a community of sorts, it's a family. And so we look out for one another. So you won't find a nurse or a nurse practitioner, nurse leader who would say no to a cup of joe, talking about next steps. If you're interested in academia, um, you could talk to nurses about getting your PhD. If you're interested in becoming a doctoral prepared nurse practitioner, you can talk to other nurses there about DNP. No matter what your route is, there are nurses who have navigated that route. And so connecting with them, don't be afraid to connect. Sometimes just simply saying hi is often enough. And even meeting Meg and Quin and even other nurses at HFSA or other conferences, it's a simple, hey, where do you practice? Where do you work? And learning and being inquisitive and learning about other nurses. You'd be surprised at what they can tell you about their story and their journey and what you can pick up from them. And don't be afraid. Dare to lead. Go for it. If you want to be um, the uh, the leading nurse practitioner on your heart failure team, if you want to be one of the nurse leaders in academia, whether that be one of the directors or even a dean or whatever your passion may be, whatever it is that you want to pursue, dare to lead, go for it. I like what Meg said. I'm going to say yes to everything, and then kind of scale back from that point on, right? Because balance is important. We've got to make certain that we're taking care of ourselves, right? That's important, because we can't pour out of an empty cup. So it's important to take care of ourselves as well. But go for it, do it, try it out, or find a mentor who can model it for you. You can't know until you know. So dare to lead.
Thank you. Well, I think that's about all we have time for tonight. I just want to thank all our panelists for sharing their stories tonight and then some of the secrets to their success. I want to thank our audience for attending, and I hope that this webinar was valuable. Our goal was that you would take away at least one skill, trait, or piece of advice that you can apply to your professional life to grow as a nurse leader. We need you as a nurse leader to continue to work to improve heart failure patient care, to grow our profession as nurses, and succeed as a heart failure organization. So bring your chair. You always have a seat at the table at HFSA. Thank you, everyone, and have a good night.